Yes, exactly. So we had about 41 cases in Beijing over the weekend, and we've had a few residential compounds now in lockdown, and a lot of people in one of the more central business districts. A lot of them have now had to go and get tested, and obviously the situation in Shanghai, where we've had people in lockdown for over a month in some cases, has prompted people, and obviously the food scarcity as well, has really prompted people to go and stock up. And I mean, we would call it panic buying, but it's sort of, as a lot of the interviewees in my colleague's story in Beijing have said, it's not necessarily panic buying, it's sort of rational stocking up in that case, considering what's happened in Shanghai, where people are, frustration is obviously rising there, where people have been in lockdown for so long. So obviously it would be a massive deal for Beijing to go into lockdown. Already the Chinese economy is under a lot of pressure. Consumption is obviously down, and this comes after the real estate crisis there. So it is of a huge concern were those cases to not get under control and were the whole city to have to go into lockdown. Obviously that hasn't happened yet, but it's something to watch, especially considering that the authorities are now demanding compulsory tests.
Yeah, and there's nothing to suggest that they're not going to go down the same path. I mean, we've even seen just images now emerging of green fences being placed around residential compounds. This is in Shanghai, I mean, how are people feeling about, as you point out, a month in, and there's no sign that anything's going to let up?
Yeah, so I think it's become quite a serious situation, and authorities would obviously be getting concerned about social stability issues there. So not only have we seen such a big outcry of frustration on social media, probably the biggest outcry since Wuhan in China. And that's with people getting around censors. This is stuff that, China has so many censors ready to delete things, but they've been able to get through. So there is very much a sense of rising frustration among some of these residents. And as you say, in specific compounds in Shanghai, they've been putting these fences around, which, you can imagine is also a fire hazard in some cases. And I mean, they have let out some residents, but cases are still rising in Shanghai. They're making up still the majority of the national total. And it doesn't seem to be getting any easier. So that is definitely going to be something that we have to watch. And I mean, it's not certain that that's going to happen in Beijing. We have seen in the past the Chinese government has been able to get on top of some of these outbreaks, Shenzhen being an example. But Shenzhen, they really acted early, actually, because they'd seen the situation in Dongguan, which is a nearby sort of industrial centre, which had this quite serious lockdown and quite serious cases there. So it isn't completely certain that Beijing will go into a lockdown, but definitely there are those fears, especially when you have such a big city, and it's a question of how under control they have it in terms of how they're able to map out some of these cases. So, yeah, it's definitely something to watch.
It is interesting. And it's funny, as you say, you're talking about the outcry on social media. At the same time, the man that's credited as being the COVID hero in China for managing this pandemic so well is now being exposed for sort of touting untested treatments that he had business ties to. So the whole credibility of the whole strategy must be in question.
So there is questions now about the handing out of a number of these treatments, as you mentioned. So in order for China to get out of this COVID-0 situation, they really need to increase their vaccine coverage. So it seems kind of, for a Western audience, when you're hearing like 41 cases in Beijing, you think, oh, that's nothing, but when you're talking about a population which doesn't have the vaccine coverage that's been in the West, in some places in the West, not the whole of the West, but in a population which has not had any COVID before. It's quite serious, especially when we've seen what has happened in Hong Kong. So, but at the same time, the authorities have been handing out in Hong Kong, for example, these Chinese traditional medicines. And what we've been able to show is that Zhong Nanshan, who is, as you said, seen as sort of a godly figure in the pandemic response, and has been given one of the biggest, awards that the country gives out, has had ties to some of these medicines, which have been included in the official protocol for treating COVID. So the question is, I guess, when you've got these treatments going out, when you've got the focus being so much on COVID zero, the question is the same focus going into vaccine coverage, particularly among the elderly, which was the population in Hong Kong where we saw the most deaths, obviously. And, because the only path out is really through increasing that vaccine coverage. So yeah, that sort of creates this question between two of those approaches. But when you have officials and officially, recognised figures which are highly respected, when they're touting these treatments for COVID, it does put a question over, especially when we haven't seen enough hard evidence yet of their effectiveness. Yes, it really puts over the question about what is the path out of COVID zero for China.